vein because this is the peritonsillar space and this vein is known as the paratonsillar vein. This is the another diagram showing the, and you can see the facial artery is also present and its two branches. This one is the ascending pharyngeal branch and this is the tonsillar branch. So these are the structures forming the tonsillar bed. Now the arterial supply of the tonsils, this is the common carotid artery and this one is the external carotid artery and this one is the internal carotid artery. No any branch is going towards the tonsil by the internal carotid artery, while the branches from the external carotid arteries are going to supply the tonsils. So the first of all you should know the branches, name of the branches of this external carotid artery. This is the facial artery. Sorry, this one is the facial artery. This is the lingual artery and this one is the ascending pharyngeal artery and this is the maxillary artery. These four are important branches which are arising from the external carotid artery and they give the tonsillar branches to the tonsil. This is maxillary artery giving the descending palatine artery because this tonsil is the palatine tonsil, and this is the ascending pharyngeal, which is branch of the external carotid artery, gives the another tonsillar branch. And this transverse, you can see this is the, you can say that this is the transverse palatine branch, and this is the facial artery which also gives branches to the palatine tonsil, and this is the lingual artery which gives the ascending branches to the tonsils. So the tonsils is supplied by the branches of the external carotid artery which are the maxillary artery, lingual artery, facial artery and the ascending pharyngeal artery. It is very also important one. What is the nerve supply of the tonsil is very important for the OSP, supplied by the glossopharyngeal nerve and lesser palatine branches of the sphenopalatine ganglia. So you should remember the nerve name is the glossopharyngeal. कि जब मैंने बाउंड्रीज पढ़ाई तो मैंने कहा कि इसके फ्लोर पे क्या था, ग्लॉसोमिन टंग थी और पीछे फेरिंक्स भी था, तो इससे this nerve is going to supply the tonsils and the lesser palatine which are the branches of the sphenopalatine ganglion. This ganglion is the parasympathetic ganglion. Now the what is acute tonsillitis? Itis mean infection or inflammation of the any organ. So it is known as the acute tonsillitis, and it mostly occurs in school going children, and it may also affect the adults, and in this condition is known as the acute tonsillitis. अगर साल में 5 या 6 मरतबा बार बार टॉन्सिलाइटिस हो रहा है तो फिर हमें टॉन्सिलेक्टमी करानी चाहिए. In this diagram, you can see this is the anterior 1/3 of tongue and this is the posterior 1/3 of tongue. In OSP, mostly they ask why this, what is this? This is the posterior 1/3 of tongue, and why it is rough? Because it is consisting of buried lingual tonsils. Now this is the histological diagram. You can see this is the epithelium. And these are the nodules, lymphatic nodules with germinal centers. So, and this is also showing the lymphatic nodules in the ring form, and this is the crypt, deep crypt. And this epithelium is the stratified squamous non-keratinized epithelium. And while this epithelium is the showing the light area which is showing indicating the presence of the goblet cell. So this is the pseudostratified epithelium. So with the tonsils which are lined by the pseudostratified epithelium are the pharyngeal tonsils, because the respiratory epithelium is the pseudostratified epithelium, while the tonsils which are lined by the stratified squamous non-keratinized epithelium are the palatine tonsils. So this is the palatine tonsil and this is the pharyngeal tonsils. You should know the difference between two by the recognizing the epithelium. This epithelium is stratified squamous, non-keratinized. In surface तक आपको nuclei नजर आ रहे हैं. So this tonsil will be the palatine tonsil, and this is the pseudostratified epithelium. So this is the pharyngeal tonsil. And in this diagram, you can see these are the glands which are so, because these tonsils are buried in the tongue, superior one third of tongue. So these are known as the lingual tonsil. So the tonsils developed by this blue color is known as the cleft, and which is formed by the ectoderm, and this brownish color is the mesoderm, known as the pharyngeal arch, and this yellow color is known as the pharyngeal pouch, which are yellow in color. So the tonsil developed by the second pharyngeal pouch. It is very important. And thymus developed from the third pharyngeal pouch, not the arch, not by the cleft. So you should remember that the tonsils developed by the second pharyngeal pouch and the thymus developed by the third pharyngeal pouch. These are the BCQ. Select the incorrect statement about the palatine tonsil. It is enclosed in the lateral wall of the oropharynx. Its medial surface is lined by the keratinized, not the keratinized. I have told you this it is lined by the non-keratinized epithelium. Its lateral surface is covered by capsule. Its apex extend upward into the soft palate. So it is for your practice. Where is the location of the? In last slide, I will give the answers of these questions. So you should try yourself. The tonsillar bed is formed by all of the following structures, except pharyngobasilar fascia. Yes, this is the pharyngobasilar fascia. This green color. Stylopharyngeus muscle. Superior constrictor, yes, this is the superior constrictor muscle, and styloglossus, yes, this is style. So the incorrect answer should be stylopharyngeus. A pathologist received a specimen of lymphoid organ for examination. On microscope examination, he find a part is covered by stratified squamous epithelium. So the tonsil will be palatine. This one. Pharyngeal tonsils are present in posterior-superior wall of the nasopharynx. Posterior-superior wall of nasopharynx. Which of the following artery does not supply the palatine tonsil? अब मैंने आपको बताया था the external carotid artery कौन कौन सी branches देती हैं arteries? Lingual, facial, ascending pharyngeal, and then maxillary. तो facial भी है, lingual भी है, इंटरनल कैरोटिड पैलेटाइन भी है, क्योंकि पैलेटाइन आर्टरीज के नाम से जा रही हैं. इंटरनल कैरोटिड से ब्रांचेस नहीं जाती. these all are the branches of the external carotid artery. So this one is the wrong answer. D is the wrong. This is OSPI with answer. Name the condition. This is the tonsillitis, because देखिए white pages देख रहे हैं आप, ये इन्फ्लामेशन को जाहिर कर रहे हैं. ठीक है, अगर व्हाइट पेजेस ना होते और टॉन्सिल होता तो हम इसको पैलेटाइन टॉन्सिल बोलते. Where are the palatine tonsils located? Palatine tonsils are located in the posterolateral wall of the oral cavity. ये आंसर है उस BCQ का, इसमें ढूंढना आपको. ठीक है, in the tonsillar sinus or tonsillar fossa between the palatoglossal and the palatopharyngeal folds or arches. Enumerate the component of the Hilwalder's lymphatics. मैंने आपको बताया था कौन कौन सी lymphatics आती हैं, उसमें कौन कौन से tonsils आते हैं. What is lining epithelium of palatine tonsils? मैंने भी बताया, covered by the stratified squamous non-keratinized epithelium, and lingual की भी दोनों की यही होगी, stratified squamous, क्योंकि टंग की यही होती है. ठीक है, वो टंग के posterior one third पे buried है. What are palatine crypts? Deep invagination of the stratified squamous epithelium covering of the palatine tonsil, frequently consisting of debris. So this is all about the tonsil.